Wisconsin ranks second in the nation for fall-related deaths for senior citizens ages 65 and older.
And even if a fall does not cause significant injury, it can lead to fear for older individuals. Our Valina Jones explains just how the elderly are being affected. Valina?
Well, that's right. Wisconsin has more than twice the national rate of fall-related deaths. And while many factors contribute to that number, health experts say these falls can be prevented.
I wasn't planning to get old at age 67.
As a registered nurse, Christina Binchy did not think she would become somebody else's patient so soon.
I had PTSD for quite a long time from the stairs.
Last year, Binchy had two major falls within months of each other, breaking her sacrum and causing a concussion.
I could have died when I fell down those stairs.
She's just one of the 800,000 hospitalizations and 2.8 million seniors who visit the emergency room for fall-related injuries a year in the United States. In Wisconsin, 48 counties saw a 50% increase in hospital visits in those ages 65 and older in a 4-year period.
We're an aging population, okay? People want to stay in their own homes. People are sicker, okay, in regard to having multiple systems problems.
Wisconsin ranks second in the nation for fall-related deaths, doubling the national average.
Not talking just about the bone healing, we're talking about risk for pneumonia, different things, or an infection that can occur.
Now Binchy has rails in front of her house and in the bathroom to help her along the way. The program, Safe at Home, provided a safety assessment and helped make necessary changes to reduce risk of future falls.
If we can prevent those from happening in the first place, we can keep people safe and independent and living their life how they want to live.
A life with peace of mind and independence.
And I don't need my neighbor to help me with so many things. And I do feel more secure.
Now, these falls are also costly. At least $771 million in hospital costs were attributed to falls in 2015. These falls are preventable, according to the Center for Disease Control. 1 million falls could be prevented with providers using effective screenings and treatment over the span of 5 years.
Valina Jones in studio with us tonight. Valina, thank you.